Hello friends, welcome back. We continue with our study of understanding pharmacological actions. And in this particular video lesson, we shall be looking at what we call paradoxical actions. Paradoxical reactions or effects of a drug are effects which are opposite to the effect which you would normally expect from the drug. For example, a pain drug causing pain. That's the paradox. We are all very familiar with this particular phenomenon, but we shall just be doing a review of some salient features. Let's look at the eagle effect, which is so called in honor of its discoverer, Harry Eagle, and that was regarding microbial activity. What Dr. Eagle found was that antibiotics, when they were added to a culture, the germ population dropped. That was just expected. That's what an antibiotic is supposed to do, reduce the germ population. But if there was an increase in the antibiotic concentration, the germ population began to increase. That sums up the paradoxical effect of a medicinal substance. First, we'll have a look at diuretics. The purpose of giving diuretics is to diminish the volume of plasma and thereby reduce edema, swollen feet, which is a common complaint, and to reduce arterial hypertension. They are also used to relieve congestive heart failure. But it is found that after we stop using the diuretics, there is what we call as a rebound of these symptoms on withdrawal. For example, the retention of sodium goes up, the retention of potassium is increased, there is more retention of water, and there is an increase in the basal volume of plasma. Exactly the opposite of what diuretics were supposed to do. Once again, we take another example of antacids. They help in persons who are suffering from complaints of acidity in the stomach. They are used for gastritis treatment, and they are also used to provide relief in gastroduodenal ulcers. However, there is a rebound action. Once the complaint goes away and the person stops taking the medicine, it comes back with a vengeance, with anger, with even stronger symptoms. There's an increased production of hydrochloric acid in the stomach, and it goes on to perforate and create chronic gastroduodenal ulcers. So what it was supposed to treat, once the symptoms go away and the person stops taking the medicine, they come back in anger. Another example is bronchodilators. They worsen the constriction after discontinuation. There are different types of bronchodilators used, which I mentioned over here, and each one of them exhibits the same kind of a paradoxical effect once they are discontinued. Yet another example which is very important is the anti-resorptive drugs which are used for osteoporosis. The effect after stopping them is increased osteoclastic activity after biological half-life. So once the biological half-life of the drug is over, the bone destruction property, the osteoclastic activity, is increased, and that leads to paradoxical atypical fractures, a serious condition indeed. The same thing applies for immune modulatory drugs. These immunomodulatory drugs, if discontinued, the multiple sclerosis worsens. And as a matter of fact, a new cluster of symptoms appears, which is known as the immune reconstitution inflammatory syndrome, or the IRIS or IRIS. There are many other examples. The serotonin reuptake inhibitors, they exacerbate suicidal mentality, exactly what they were supposed to suppress. Beta blockers, they cause irreversible bronchospasms. Statins, which we use for reducing LDL cholesterol, they can lead to fatal vascular events. And antithrombotics, which are supposed to prevent thrombosis or clots of blood, they result in thrombotic complications. All this is well known and documented. Of course, it doesn't happen to everyone, but there are some people who are more susceptible. But who exactly they are, our science currently does not tell us much about it. But what we can learn is that essentially this is a property of all medicinal substances. Now let's take a look at the time that it takes for the rebound effect to happen. With the serotonin reuptake inhibitors, 7 days. The non-steroidal over-the-counter anti-inflammatory drugs, they can have that effect after 14 days. Statins, 7 days. And PPIs, proton pump inhibitors, which people often take for acidity, they will have a return of symptoms after just 7 days. In other words, every class of drug exhibits a paradoxical reaction. Here's the whole list, and this is not complete. Amphetamines, antibiotics, antidepressants, antipsychotics, benzodiazepams, all these tranquilizers which are used can in fact cause mania and even criminal acts. So what does all this tell us? This tells us that every drug or medicinal substance has a primary action, which we see when we are getting a relief of the symptoms. And this is followed by a secondary action. How this happens or why this happens is quite complex and complicated. But we know this for a fact. And homeopathy harnesses this property to heal rather than to harm. This is something that is very interesting and is overlooked in other forms of medical treatment or education. And the purpose of this course is to allow you to use this property to help your patients. Thank you very much. That brings us to the end of this lesson. Thanks for your attention, and we'll meet once again in the lesson that follows. Until then, bye-bye.